Understanding heart attacks, a guide to prevention and early action. Did you know that heart attacks are a leading cause of death worldwide? Recognizing the early signs and understanding the risks can save lives. Let's dive into what you need to know to protect your heart and the hearts of your loved ones. A heart attack, also known as a myocardial infarction, MI, occurs when blood flow to a part of the heart is blocked. This blockage deprives the heart muscle of oxygen and nutrients, leading to damage or death of the tissue. It's a critical medical emergency that requires immediate attention. The heart is a powerful muscle responsible for pumping oxygen-rich blood throughout your body. This vital function is supported by coronary arteries, which supply the heart muscle itself with the necessary oxygen and nutrients. When these arteries become blocked, a heart attack occurs. Atherosclerosis is the most common culprit behind heart attacks. This condition involves the gradual buildup of cholesterol-rich plaque inside the arteries. Over time, this plaque can rupture, leading to the formation of a blood clot that blocks blood flow. Less common causes include vasospasms, which are sudden constrictions of the coronary arteries, often triggered by drugs like cocaine, smoking, stress, or exposure to cold. Another rare cause is coronary artery dissection, where a tear develops in the artery wall, obstructing blood flow. Early recognition of heart attack symptoms is crucial. Some heart attacks strike suddenly and intensely, but most start slowly with mild pain or discomfort. Don't ignore these warning signs. Prompt action can significantly reduce heart damage. The most common symptom is chest discomfort. This may feel like pressure, squeezing, fullness, or pain in the center of the chest, lasting for more than a few minutes or coming and going. It's not just a fleeting twinge, it's a persistent discomfort. Other symptoms include pain or discomfort in other areas of the upper body, such as one or both arms, the back, neck, jaw, or stomach. You might also experience shortness of breath, which can occur with or without chest discomfort. Additional symptoms to watch out for are cold sweats, nausea, vomiting, lightheadedness, and a sense of anxiety or impending doom. Women are more likely to experience symptoms like shortness of breath, nausea, vomiting, and back or jaw pain. If you experience any of these symptoms, don't hesitate. Call emergency services immediately. Time is muscle, and the faster you receive treatment, the less damage your heart will sustain. Cardiologists often refer to the golden hour, the first hour after a heart attack begins. The actions taken during this period can significantly impact a person's survival and long-term health. Rapid response and treatment are essential. During the golden hour, the heart muscle is most vulnerable to damage from lack of oxygen. Prompt medical intervention can restore blood flow, minimize damage, and improve the chances of a full recovery. Don't delay seeking help, hoping the symptoms will disappear. There are two main types of heart attacks: ST segment elevation, myocardial infarction, STEMI, and non-ST segment elevation, myocardial infarction, NSTEMI. These classifications are based on the patterns observed on an electrocardiogram, ECG. In a STEMI, there is a complete blockage of a coronary artery, which is evident on the ECG. This type of heart attack requires immediate intervention to restore blood flow. In an NSTEMI, there is a partial blockage, and the ECG changes may be less obvious. Understanding your risk factors is essential for preventing heart attacks. Some risk factors are beyond your control, such as age and family history, but many can be modified through lifestyle changes. Men over 45 and women over 55 are at higher risk. Women are typically protected by estrogen until menopause. A family history of early heart disease before age 55 in men and 65 in women significantly increases your risk. Modifiable risk factors include smoking, high blood pressure, high cholesterol, obesity, diabetes, a sedentary lifestyle, and stress. Addressing these factors can dramatically reduce your risk of a heart attack. Recent data shows a concerning increase in heart attacks among young adults. This trend is primarily attributed to the rising prevalence of risk factors like high blood pressure, diabetes, high cholesterol, obesity, stress, smoking, and physical inactivity in this age group. Unhealthy lifestyle choices are largely to blame. Additionally, young adults may not recognize or take early warning signs seriously, leading to delayed treatment and worse outcomes. It's crucial for young people to be aware of their risk and take preventive measures. Treatment for a heart attack aims to restore blood flow to the blocked artery as quickly as possible. This may involve medications, procedures, or a combination of both. The specific treatment approach depends on the type and severity of the heart attack. Initial treatments often include oxygen therapy, aspirin, nitroglycerin, and morphine to relieve pain and improve blood flow. Beta blockers may be used to slow the heart rate and reduce oxygen demand. Thrombolytic therapy, also known as clot-busting drugs, can dissolve blood clots and restore blood flow. However, the preferred treatment is often coronary angioplasty, especially if available at a nearby hospital. Coronary angioplasty involves inserting a thin tube, catheter, into an artery and guiding it to the blocked coronary artery. A balloon is then inflated to compress the plaque against the artery walls, opening up the blood vessel. A stent, a small mesh tube, is often placed in the artery to keep it open and prevent it from narrowing again. This procedure can quickly restore blood flow and minimize heart damage. Preventing a heart attack is often possible through lifestyle changes and managing risk factors. Simple changes can make a big difference in your heart health. Quitting smoking is one of the most effective ways to reduce your risk. Maintaining a healthy blood pressure, around 120/80 mmHg, is also crucial. If you have diabetes, keep your blood sugar levels well controlled. Adopting a heart-healthy diet is essential. This includes limiting sugar, processed foods, and salt, and eating plenty of fruits, vegetables, and whole grains. Reduce your intake of red meat and fried foods. Lowering cholesterol and triglyceride levels through diet and medication, if necessary, is also important. Regular exercise, even moderate activity, can significantly improve your heart health. Maintaining a healthy weight, getting 7 to 9 hours of sleep per night, and managing stress are also vital for heart health. Social connections and avoiding isolation can also reduce your risk. Regular checkups with a cardiologist are recommended, especially if you have a family history of heart disease. Early detection and intervention can prevent serious complications. Advancements in diagnostic technology have improved our ability to detect heart disease early. One such tool is the coronary angio-CT scan, which provides detailed images of the coronary arteries without the need for invasive procedures. This scan can identify plaque buildup and blockages, allowing for early intervention and prevention of heart attacks. While not suitable for everyone due to radiation exposure and the need for contrast dye, it's a valuable tool for those at higher risk. If you are at risk of a heart attack or have a history of heart disease, it's essential to have an emergency action plan in place. This plan can help you and your loved ones respond quickly and effectively in the event of a heart attack. Keep a list of your medications, allergies, and your doctor's contact information readily available. Have a copy of your baseline ECG on your phone. Know the location of the nearest hospital with emergency cardiac care. Having a plan in place can save valuable time and ensure you receive the best possible care during a heart attack. Preparation is key to improving outcomes and protecting your heart. Your heart health is in your hands. By understanding the risks, recognizing the symptoms, and taking preventive measures, you can significantly reduce your risk of a heart attack. Don't wait until it's too late. Here's what you can do right now. Share this video with your friends and family to raise awareness about heart attack prevention and early detection. Schedule a checkup with your doctor to assess your risk factors and discuss preventive strategies. Commit to making one heart-healthy change in your lifestyle today, whether it's quitting smoking, eating a healthier diet, or starting an exercise program. Protect your heart. Protect your life. Take action today.